On August 27, 1961, the scorching summer sun beat down relentlessly in Westminster, Maryland, creating temperatures that newspaper reporters later referred to as boiling. On a hillside plateau just below Memorial Drive, a crowd of 1,500 people gathered before a new and thoroughly modern one-story building. And yet, no one seemed to mind the heat. On this Sunday afternoon, the citizens of Carroll County had come together to celebrate their dream, the completion of their very own hospital.
It was a beautiful day, and the people gathered around, and we were all excited about this little hospital we were building. It was 5 years before we actually opened the hospital. From the time we had a public meeting to see whether it was a popular thing to build a hospital. So then we worked getting support, raising money, doing all the things that are necessary to build a hospital. And we opened it on October the 1st, 1961.
Carroll County General Hospital was, by all accounts, a hospital built by the community for the community, the result of an unprecedented county-wide door-to-door campaign that raised money from citizens in every conceivable pocket of this then rural county. Together, community leaders, ordinary citizens, church and civic club members, and revered doctors, lawyers, and businessmen had worked to build this hospital, a project that county leaders had been trying to develop for as long as most in Carroll County could remember.
There was a generation of momentum, I think, that we needed to have a local hospital. So the founders got together, people from the community, driven by physicians, but then really taken on by local citizens. And so the vision was to let's bring primary health care facility into the community.
At the dedication ceremony, the immediate benefit was obvious to everyone. The gleaming $1.5 million medical facility meant that Carroll County residents now had a local hospital they could call their own. But in the coming decades, it would come to represent something much more than the obvious, something much bigger than a new building in a convenient location.
I feel privileged that my husband and I are able to be a member of the Founder Circle, and I feel privileged that we can give back to the community that has given so much, to us. 2 of our children were born here, and I was able to be, on the staff working in areas of the hospital that I loved. For many years I was the head nurse of labor and delivery, and I loved my obstetric experience, taught childbirth classes and had the first childbirth classes in Carroll County. I mean, it's just been an unbelievable experience to have been right in the very beginning of the hospital, to see how it has expanded and to see all the different programs that are now available for the community.
As the hospital has evolved into Carroll Hospital Center, it has grown from a local community hospital into a comprehensive medical center, recognized as an innovative healthcare partner for the entire region. It features the latest in medical technology and facilities, experienced medical professionals in a wealth of specialties, a caring, skilled nursing staff, and a continuum of programs and services that seek to address the healthcare needs of citizens in Carroll County and the surrounding communities at every stage of life.
When I started the laparoscopy, and particularly the laparoscopic hysterectomy, the word got around that we do this here. And they don't do it in Baltimore, they don't do it anywhere.
As time has moved on, the hospital has tremendously expanded the facilities, but also the staff and the things that they can do here. So we're now at the point where there aren't many things that patients need to leave Carroll County for to go elsewhere to get, which makes it great in the environment that you have here, a nice, kind, caring hospital with excellent services.
From the family birthplace to our inpatient hospice facility, Dove House, from the Carroll Regional Cancer Center and Cardiovascular Institute to expanded emergency care and behavioral health services, Carroll Hospital Center continues to develop programs and services that answer the founding community's original vision. It was a vision first shared on that scorching hot dedication day in 1961 by founding member Dr. Charles L. Billingsley. May we cure sometimes, may we relieve often. but may we comfort always. It's a vision that continues to drive us even in the face of turbulent change.
We know that the role of the hospital in the future is really going to be the community integrator of care. And we recognize that it means we as hospitals have a duty to redirect healthcare towards wellness care as part of saving the healthcare system in this country. Looking back at what the founders' vision was for that hospital, clearly they wanted to see a comprehensive hospital grow with the community. As the community got bigger, they wanted to see services expand and grow in sophistication. And so having that vision to create that hospital was a critical big step in adding to the success and the life and vitality of this community.